Good morning, dear students. Hope you all are fine and safe at home. This is Dr. Jyosana from BPT Department, RPIIT College. Today, I have come with the next part of ankle sprain, that is rehabilitation of ankle sprain. Rehabilitation means restoring your injured area back to normal through gradual training and therapy. And I'll focus in this presentation on the physiotherapy management, which is very much crucial on treating grade 1 and grade 2 ankle injuries. Physiotherapy is required with functional therapy of the ankle shown to be more efficient than immobilization. Immobilization means not moving your injured area at all. Functional therapy treatment can be divided into 4 stages: inflammatory phase, proliferative phase, early remodeling, late maturation and remodeling phase. So first is the inflammatory phase, which is from 0 to 3 days, and goal of this phase is the pain and swelling reduction, improve circulation through partial foot support. The most common approach to manage ankle sprain in this phase is Price protocol. P. Protection. Protect the area or ankle from further injury by resting and avoiding activities that may cause further injury. R. Rest. Rest is advisable for the first 24 hours after injury, possibly with crutches. I. Ice. Apply ice for 15 to 20 minutes 1 to 3 times per day. C. Compression. Apply compression bandage to control swelling caused by ankle sprain. E. Elevation. Ideally elevate ankle above the level of heart. And R for rehabilitation, that is the functional exercises and gradual training. Along with these Price protocol, we'll do foot and ankle range of motion exercises. Patient perform active movements with the toes and ankle within pain-free limits to improve local circulation. Manual therapy in the acute phase could also effectively increase ankle dorsiflexion. Anterior-posterior manipulation and rise results in greater improvement in range of movement rather than application of rise alone. So some of the exercises which should be included in this phase are the ankle ABCs. Ask the patient to be sit position, write the alphabet in the air with your big toe, write both uppercase and lowercase letters. Some exercises like ankle dorsiflexion, plantar flexion. Dorsiflexion means movement of foot towards your body, and plantar flexion movement of foot away from your body. And ankle inversion and eversion. Inversion means movement of foot towards your another foot. Eversion means movement of foot apart from your another foot. So these are the simple exercises which should be started as early as possible, and these in the pain-free range. Next phase is the proliferative phase, which is 4 to 10 days. Goal of this phase is the recovery of foot and ankle function and improved load carrying capacity. Educate the patient regarding gradual increase in activity level guided by symptoms. Practice foot and ankle functions, range of motion, active stability, motor coordination, and it is very much important to begin early with the rehabilitation of the ankle. First week exercises produce significant improvement to short-term ankle function. Taping and bracing apply as soon as swelling has decreased. Tape or brace use depends on patient preference. This is the technique of ankle taping, which should be done in the ankle sprain treatment. Next is the early remodeling phase, which is from 11 to 20 days. Improvement in the muscle strength, active functional stability, foot ankle motion, mobility, walking stairs, running. These are some of the goals which should be in the early remodeling phase. Provide information about possible preventive measures. Advise regarding appropriate shoes to wear during sport activities in relation to the type of sport and surface. Practice foot and ankle functions, balance, muscle strength, ankle foot motion, mobility. Look for symmetric back pattern. Work on dynamic stability as soon as load bearing capacity allows, focusing on balance and coordination exercises. Gradually progress the loading from static to dynamic exercises, from partially loaded to fully loaded exercises, and from simple to functional multitasking exercises. Alternate cycled with non-cycled exercises. Use different types of surfaces to increase the level of difficulty, like from soft to hard surface. Encourage the patient to continue practicing the functional activities at home with precise instructions regarding the expectation for each exercise. So these are some of the ankle exercises. Resisted ankle motion, which is done in the early remodeling phase. These are the same exercises which we were doing in the earlier two phases, like dorsiflexion, plantar flexion, ankle inversion and eversion. But now we are applying resistance with the use of TheraBand. This will help in strengthening the ankle muscles. Some more exercises to be included in this phase are partial weight bearing seated calf raises. Ask the patient to sit in a chair with the injured foot on the floor as seen in the first diagram. Lift your heel as far as possible while keeping your toes on the floor. Return heel to the floor. Second, partial weight bearing standing weight shift. So stand upright while holding on to a stable object. Shift some of your weight onto injured foot. Hold the position for 15 seconds. Third is the full weight bearing single leg stance. Stand on the injured foot while lifting the uninjured foot off the ground. Hold the position for 15 seconds as seen in the second diagram. Full weight bearing standing calf raises. Ask the patient to stand on the injured foot while lifting the uninjured foot off the ground. Raise up, standing only on the ball of injured foot, that is toes of the injured foot, and lifting your heel off the ground. Hold this position for 15 seconds, relax and put your weight back onto your uninjured foot as seen in the third diagram. Tapping and bracing will continue along with the static and dynamic balance and motor coordination exercises. Last phase is the late remodeling and maturation. Improve the regional load carrying capacity, walking skills, improve the skills needed during activities of daily living as well as work and sports are the main goals of this phase. And the exercises which should be included in this phase are the full weight bearing, lateral stepping. And this patient asks the patient to stand upright while holding on a stable object. Place a roll towel or a short object on the ground to the side of your injured foot as seen in the first diagram. Step over the towel with the injured foot and remain on that foot. Then bring the uninjured foot over the object and stand on both feet. Repeat the process as seen in the first diagram. Full weight bearing lateral jump. Place a roll towel or short object on the ground to the side of your injured foot. Hop over the towel and land on the injured foot. Then hop back over the towel and land on the uninjured foot as seen in the second diagram. Third is the single leg stance on a towel. Fold the towel into a small rectangle. Place on the ground. Stand with injured foot on the towel. Lift the uninjured leg off the ground. That means standing only on the injured foot on the towel with the injured leg. Hold for 15 seconds. Return your injured foot to the floor. So practice motor coordination skills while performing mobility exercises. Continue to progress the load bearing capacity as described above until the pre-injury load carrying capacity is reached. Increase the complexity of motor coordination exercises in varied situations until the pre-injury level is reached. Encourage the patient to continue practicing at home. So these are some of the important exercises which should be included in the physiotherapy management and can be done at home also for the ankle sprain grade 1 and grade 2 treatment. Thank you so much. Hope this will help you a lot.